Good evening. Hi, this is Dr. Verdiales from the Georgia office. Um, as always, I like to pick an interesting subject that it has been either recurrent or has shown up in the last week. And it happened today and actually yesterday as well. I've had two patients ask, what else can I do to optimize my transfer? Both patients had previous transfers with failed results. So, what else can we do? And so, I'm going to put a few things out there for you. So, if you're if you had, one, two, three failed transfers, you need to think outside the box. Are we dealing with silent endometriosis? Silent. It's not truly silent, but sometimes it's just not as painful, and so it gets dismissed a lot. Because when we talk about menses, it's like, what is normal menses, right? What is normal cramping? It's so individual that maybe you've had cramping all your life and you think that is normal because that's normal to you. So that's what it's really silent endometriosis. So we have to think about endometriosis. We have to think about adenomyosis, which is a close relative of endometriosis. We have to think about chronic infection. I've been seeing this a lot, even in my GYN patients, where our female organs are open to the outside. We don't realize it, but that's how it is. You have the cervix, which is a selective barrier, okay, which is open essentially. Then you have the uterus, and the tubes, if they're present, are going to be open to your insides. So as we engage in sexual activity throughout our lives, we're introducing foreign material and foreign bugs up there. And sometimes they find a nice, cushy place to live in our uteruses. The uterus is a capsule, so you're not going to necessarily feel sick, even though most endometritis will show some sort of, signs. I see my GYN patients kind of a little heavier bleeding, some increased pain with periods, some increased pain with sex. So there might be some signs there that are not very specific, and that could be related to chronic infection in the uterus, and that needs to be addressed. As we're doing more extensive testing with the Alicia and Emma testing, we're seeing that not only are we handling infection, but we're handling also decreased natural flora. If you don't have your little soldiers in there to protect your vagina and uterus, then even if you are exposed to antibiotics to get rid of the bad stuff, you don't have the good stuff to protect you, okay? Throughout our bodies, we have bacteria that help us, okay? We have a symbiotic relationship. And that's very important. They talk about the gut microbe, the microbiome. All right, so the gut probiotics and the importance in terms of general health, mental health, immune health. So it's a lot more complex than we thought at the beginning. So we need to check on those things. Of course, everybody talks about the ERA and the endometrial receptivity assay, even though honestly, in my experience, that's a very, very small group. Most women will be in sync with their embryos. All right. So what else can we do? So we talk about the ACG wash, Neupogen wash, PRP wash, acupuncture, fertility massage, intralipids. How about meditation? All right. There's a lot of programs where you focus all of your energy in your womb, you talk to your uterus, all of that, all of those things help. And even if they help 1, 2 degrees, right? There's a saying that 1 degree of change here, it's going to just keep growing, and it could be that little extra push in your favor. So I'm a fervent believer of integrative health. I believe that that's where the magic happens, is when you do the mind, body, soul, and then you use all of these tools to make the magic happen. So that was the conversation I had with my patient. So I'm gonna go back to one of them because there were two. One, she underwent, she has her embryos, two failed transfers. We had to do a second extensive myomectomy because of just her fibroids just kept popping. On her last fibroid removal, we took out 14 fibroids. And there was some endometriosis, maybe adenomyosis found. So um, we put her on Lupron with add-on therapy. This is very important, people, because not a lot of you are aware that you can actually have a little bit of add-back therapy for side effects for Lupron or Elisa. It's called norethindrone. And so we did add-back therapy, and then we did acupuncture, diet, supplements, fertility massage, and she came for a baseline 2 months into all of this and 2 months of Lupron because she was going to be on Lupron for 2 months. And she had the best uterus I've seen in her ever. Okay. So there's a lot of things. And we had the conversation of actually doing a PRP wash early in her transfer cycle and potentially a Neupogen wash. Neupogen helps with lining, and an ACG wash that helps with receptivity to increase her chances of pregnancy. In her case, because she's had 3 failed transfers, she's going to transfer 2. Those of you have heard me before. I always like to start one at a time, just because, if you have 6 embryos, that's 6 chances of potentially having a baby. But if you do 2 at a time, that means that's only 3 chances. And in the IVF world, it's a hit and miss to some degree. It's like cooking, right? So at first you go through the recipe, and then you're thinking, we could tweak this a little more and add this, take this out. So even though some of you are very fortunate and blessed to get pregnant on that first transfer, that's not the majority. It's usually on transfer 2, 3, sometimes even 4 when the magic happens, when that tweaking happens, okay? And again, I've seen it where it's mind, body, soul. Yesterday, I saw one of our beautiful ladies. She's using donor eggs. I think she's 50. I want to say she's 50. And at first, she came in very headstrong, and her husband very headstrong, and this is what we want, and da 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 da. And I knew in my heart that was not the right space for her. And so she's had 2 miscarriages with donor egg embryos. And yesterday, her energy had shifted. She was calm. Her husband was outside. He was not in my face. And she was calm, and she was, taking it in. And I just knew she's ready to be a mom. I just, I saw her. I told my staff, she's ready. This transfer is going to work. So I'm kind of excited. I'll keep it in, but I'll keep you posted. All right. So those are a few of the things that you can do for add-ons. There's some talk about human growth hormone be used for transfer. I can see why that could be a benefit. So I would not completely discard that. Of course, there's all the immune protocols all the way to IVIG. Why do we use a lot of immune protocols? It's because a lot of times, I would say a large amount of infertility or fertility challenges, I would rather say, it's related to inflammation, autoimmunity. So anything that we can do to decrease that, or rejection, that's why we use the Prograf so much, then it's definitely an add-on that would have some benefit. And again, 1 degree of change could make the difference down the road. I see that you guys are a little active tonight, so let's see what your questions are for today. So before transfer, intralipids, how many days before or after? So intralipids, why do we do intralipids? Intralipids are precursors of our hormones, and they're also associated with decreasing inflammation. You can do intralipids from the day before transfer, to do it weekly, a month before transfer, to do to do intralipids even with egg retrieval. I've had patients add intralipids to their egg retrievals with really cool results. Okay. Do you suggest having a repeat SSG after giving birth before doing an FET? We suggest doing a saline ultrasound. I actually suggested a lady today, she has stage 4 endometriosis, and she has an IUD in place to try to keep her endometriosis a little bit at bay. And so I did suggest that we do a saline after her IUD is out, just to make sure the cavity is perfect. Why do we do so many salines? And this is a question I get a lot of time from patients. Can somebody get pregnant with a polyp? Absolutely. Can somebody get pregnant with an irregular uterine lining? Absolutely. However, us as doctors and your fertility coaches, we're here to try to optimize your chances. So we don't want anything to interfere with the possibility of you being successful. That is the reason we're checking on that cavity all the time. Would those kind of condition infections show up on a saline sonogram? No. If you have endometritis, the only way to figure that out is with a biopsy. The traditional biopsy is just going to say that you have endometritis, but the ALICE EMA is actually going to say which bug is in there and if you're lacking any good probiotics. What about ACG wash and ACG boosters? I love ACG washes. So this is how I see all these washes. The PRP helps with optimization of the functionality of the uterus. It's not, even though there's some talk out there about increasing lining size, it's not about increasing lining size. It's about optimization and functionality of the lining. Neupogen wash increases lining. It's great for that. And the ACG wash increases receptivity. So the ACG wash kind of welcomes the baby and makes it more baby happy. The PRP will make it work better, and the Neupogen wash makes it fluffier. Okay. All right. All right. Yes. So, Miss Letitia. So, yes, I like to do personally. I like to do my washes not all at the same time. I know that in some of the other clinics, they just put everything in the same place all at once. I like to let each product medication work. So I like to do my PRP wash early on. All right. Meaning sometimes if it's one of my local patients, I'll do it during the estrogen or the beginning phase. If it's a later patient and you can't, then I would try to do it as soon as you possibly can. So it could be PRP wash 48 hours before, and then the ACG wash 24 hours before. That's how I like to do it. If you had 2 back-to-back miscarriage through IVF, if there's anything extra that can be done to maintain pregnancy, whether you have a failed transfer or miscarriage, you still have to go through the workup. Are we dealing with adenomyosis, endometriosis, chronic infection? What else can we do to support that uterus? Even though each case is different, you still need to try to figure out what else can we do, and are we missing something? I've had patients with recurrent miscarriages with IVF go through the triple microbial, support that uterus, and finally get, the rainbow baby. What are the benefits of Cerevital? So Cerevital is a combination of different supplements, amino acids that is suggested to increase the natural secretion of human growth hormone. In my thought and experience, it's not going to hurt you. It's just kind of natural products that you would get on lesser amounts in your food. And it could increase your natural secretion of human growth hormone. So that's my thought on that. I've had 4 failed transfers, no implantation, 3 different clinics. I had polyps removed, myomectomy. Okay, I had some fibroid skin coming and going for the 4th egg retrieval. If you had so many manipulation in your uterus, you definitely need to support the uterus. There's going to be a lot of scar tissue, potentially endometriosis, adenomyosis, just from transposition of the endometrial lining. When you cut into a uterus, even though when I do myomectomy, I try to keep the lining inside the uterus, there's still a possibility of transposition, lining in the wrong place by just surgery, and then all the scar tissue. So I would suggest that you take a deep breath. You do some prepping for your fourth egg retrieval. I'm all about prepping. I see you guys as athletes, and my job is to be the best fertility coach you can possibly have. And as a coach, I need to train you. I can't send you to the fertility Olympics with just nothing, right? So I'm all about prepping and priming. So I would do priming for the egg retrieval once you got your embryos banked, and potentially do multiple embryo banks. Then I would then focus on the uterus, potentially do Lupron. The lady I was talking about, after 2 myomectomies, I said, we need to, whatever's happening in your pelvis, it's out of control. We need to cool it off. I mean, today her uterus, I mean, I almost cried. I was so excited to see that uterus. It looked normal. And she's had 3 myomectomies. Her first myomectomy, and it was not with me, I've done two, 40 fibroids. That is like Frankenstein uterus. And today it looked beautiful. Her lining, her cavity, her uterus had minimal scar, but we've been working with supplements, gland therapy. We've been working with herbs. We've been working with enzyme therapy, PRP. She's been on Lupron for 2 months. And finally, we are scheduling her for her FET. And I am feeling really excited. I'm almost afraid of saying how excited I feel about her. All right. So in terms of, it's funny, Amanda. So you're talking about ACG versus Menopur. I've had that conversation today with the Canadian lady. Menopur, what is Menopur versus low dose ACG, and why we use one or the others? There's really not that many fertility drugs. Either you do recombinant FSH, Gonal-f, or Follistim. Menopur is human FSH and LH derived from menopausal urine women, from the menopausal urine of women. And then ACG can be used, that is recombinant, made in the lab, because it's very similar to the LH component in the Menopur. All right. Most women will do fine with the low dose ACG, and it's significantly lower. Some women, especially older women, sometimes do better on the Menopur, but Menopur does have FSH in it, and that has to be taken into consideration when the final protocol is put together. I've been moving more towards the ACG just to help you guys with money. I like spicing it up when, depending on results and what's going on. And on older women, I like to use either low dose Menopur or ACG, meaning the LH component, keeping it to the bare minimum, because a lot of times the baseline LH on women past 40 is already high. So your guys are luteinizing your follicles naturally. So we don't need to overdo it. Low dose for older ladies is the bomb. I have stage 4 endo. How long should we do? Or Lisa just had a lap endo and tube removed. All right, Celeste. So if you already had your egg retrieval, I would do that first. Okay, you want to get your embryo banking in first. My experience is that if you can commit to Lupron, works better, or Lisa at least 2 months. 2 months, it seems to be kind of the minimum magic number, especially for stage 3, 4 endo, to do a successful transfer. All right, Samantha. So you were able to get pregnant and you had a miscarriage. I know that's not exactly the outcome you wanted, and I'm terribly sorry. However, you should see it as your body is practicing. It never got pregnant, and it got pregnant. So it got a taste of it. It warmed up. So I can almost promise this is not going to happen again. Intralipids and ACG wash, absolutely put it in. again, you know, I'm such a believer in supplements. I use them, give it to my loved ones, and sharing is caring. So I believe that you should support the natural biology of the body so the body works better. So you're always welcome to message me through Messenger, and I could give you a few more tips. Newbies, I love newbies. So Emily, you started your first IVF tonight. What's new? What's tips for newbies? The first IVF cycle is going to be you're going to be a little lost, especially if you're not at your local clinic. I know that being a travel patient makes it a lot harder in the process. Just if you're a newbie, I would try to get to know your nurses, and the worst question is the one that's not asked. I'm struggling to find an SCG and a saline ultrasound. Did you do them in Atlanta? Yes, you can just call and schedule. Yes, so I send a lot of my post-ops and a lot of my priming patients to go have sex with oral letrozole at home. So that's what I do. And then just keep prepping and preparing the body to do the best it can. Your body was designed to heal itself. It wants to be in optimal health, but it does need some tools and some raw material. Just give it to it, okay? 38, should I do low dose? I think low dose is really good for almost anybody. Honestly, there's really very little need to go crazy high with those doses. I believe everybody should do some sort of priming and get their body ready. You're an athlete, you're a fertility athlete. So you're going to the fertility Olympics. So what else? There's very few women that do better on the high dose gonadotropins versus the low dose, but I think that everybody should start on a lower protocol than traditionally was done. So you said, yep, I've read it starts with an egg. It's a pretty damn good book, and I think she's pretty accurate. I know a lot of you do DHEA routinely, some crazy amounts, but she does mention that's actually a testosterone. A lot of the information in there is very good. I like a lot of glandular therapy. I have a wellness center, so you can definitely call and I can point you in the right direction because I like to do specific protocols depending on your needs. And the number is 770-266-0933. Or you can message me through Messenger, and I'll try to make sure that somebody calls you within 24 to 48 hours, okay? Yes. So the Women's Complete from Nutritional Frontier, it's actually a joint effort between Nutritional Frontier and myself. I wanted to make sure it has everything the best prenatal will have, and that it has a food-based buffer. And why is that? Because in nature, vitamin C comes out of a fruit or an animal. So you have to have all the cofactors to balance that ascorbic acid. Otherwise, it might be doing more damage than good. So I believe in food-based supplements because that's how nature intended you to get the nutrients. Okay. All right. So Lisa, you should be super proud of yourself. Super, super proud. That at 44, just keep going. Age is a number. Take a deep breath, think outside the box. And if you had a chemical, you're actually that much closer. Even though biochemicals and miscarriages can be devastating, you got pregnant. That means that you're that much closer to the rainbow baby. So just keep your eyes on the price. The fertility journey is not a sprint race, it's actually a triathlon. I say it every day. You get on the bike and then you have to swim, and then it's the obstacle course. So it's not for the weak of heart. All right. You have to be brave. And at the end, it will all be worth it. So for So those of you that have had surgery with me at one point, I am so adamant about doing PRP post-op. I try to do it a week or two after surgery. The reason being that in the PRP world, so outside of the fertility world, they've realized that PRP stimulates non-sclerotic collagen formation. What does that mean? Healing without the scarring. Um, so it's like if you had a myomectomy, just do it as soon as possible. 1 week, 2 weeks, 3 weeks. But I'd rather do it than not do it at all. Okay. Alrighty. ACG boosters. I know ACG. I mean, you know, it's not going to hurt. I like the ACG wash better than the booster. It's not going to help. It's not going to hurt. And a lot of times you already have it, so might as well use it. I do like acupuncture. So why I like acupuncture? Acupuncture or fertility massage, because you want to stimulate blood flow to that area, oxygenation, detoxification. And that's what those two modalities will do. All right. So I'm 47. Should I even bother with my own eggs? I'm getting 1 to 2 eggs each retrieval with this baseline. Alrighty, so I've had this conversation today with somebody in your age group, Melissa. 40s is the new 30s. So it really depends on how your body's behaving, what your values are. You could be 47, but still have a decent ovarian reserve for your age. One thing that us in our 40s, sometimes IVF is not the right answer. Okay. I know that it is kind of the ultimate, but that doesn't mean that it's the right choice for you. What I've been doing a lot with my 40 plus ladies is optimizing priming and hyper ovulating with IUI or time intercourse, just because older eggs do better inside your body. That's why fresh transfers day 3 do better on 40 plus ladies. So if you've been getting only 1 to 2 eggs on each retrieval, maybe IVF is just not it for you. Why don't we step back, regroup, try to optimize what you have, improve your overall health and quality, and then just hyper ovulate you. Try to get 2, 3 eggs at a time, and then try to get you pregnant the old fashioned way with the egg inside your body. So many supplements I've read about, afraid of taking too many of the wrong ones. I totally agree. So I went into the supplement world because my second husband was dying of cancer, and I took it upon my hands to make sure that he took the best supplement possible. And I realized that in the supplement world, there's a lot of liars, people that say that the supplements have what they supposedly have, but they don't. There's a lot of toxicity, byproducts that shouldn't be there. And in the past, like for example, fish oil. Why do you burn fish oil? You shouldn't actually. It's because it's rancid and it's full of chemical solvents as they're trying to pull the omega out. So a little test that you guys can do is the styrofoam test. You open the omega you're taking and pour it on raw styrofoam. If it eats up the styrofoam, I don't have to explain to you that that's not good for you. I used to when my kids were younger, they used to chew the omega pills that I brought home because that they were that soft. All right. So I agree with you, Sandy. I have the brands that I trust and I give my family and friends, and that's what I share with my patients. Of course, I cannot research all of them, but some basic stuff. You want your supplements to be food based in its majority or have a food buffer. You want supplements to have some sort of quality control. You want your supplements to be closer to nature as possible. So a lot of supplements will tell you they're food supplements, they're food concentrates, there's food derivatives, organic, clean. The more amount of different certificates in terms of quality control, the better. I would, love to share it with you. You're welcome, like I always say, to reach out to me through Messenger. And if I don't answer immediately, I'll answer within 24 to 48 hours or get somebody to answer. If it's a question that's beyond a quick, boom, 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 then we'll get you on the schedule as soon as possible so we can actually look at the details of your case. Last question of the night. First fresh transfer failed. Starting acupuncture before FET. Do you recommend acupuncture for a certain amount of time? Well, something is better than nothing at all. Most acupuncture research is around the actual transfer, meaning 24 to 48 hours, kind of both ways, 24, 24. I believe, again, I'm a fervent believer of prepping. If you can afford to do it a few weeks before, then you're prepping that organ, the uterus, to receive the embryo. But something is better than nothing. Also, you can do fertility massage. If you can find a practitioner that will do it for you, that would be best. But there's a lot of videos where you can try to do it yourself with castor oil, hot packs, etc. And clean eating and just general basic habits is the best. All right, guys. Well, thank you so much for joining me tonight. Again, if you have a particular question you want to reach out to me, feel free. I am in the Atlanta office, 770-266-3930. And I will talk to you in about 2 weeks. And next week will be in Spanish. All right. Be blessed and have a good rest of your week. Bye bye.